Good morning, everyone. Welcome to another session of Wellness webinar. So today we are talking about Know Your Heart. We have with us Dr. Kovid, who's going to tell you about how to take care of your heart, how to take care of your health, basically overall health. Nowadays, we see a lot of people having heart attacks when they are in their 40s, when they are in their 30s, which is a very disturbing trend. So, Dr. Kovid here is going to tell us about all these things. But before we proceed for the webinar, let me tell you that we have Vendors Wellness app. I have already given you orientation, so please log in to Vendors Wellness app to take your free doctor consultation, free second opinion. There's discounted lab test you can book. So I want all of you to log in to take your doctor consultation. This is a facility your company has provided for you, and we all of us we want you to log in and take the consultation. So we'll proceed with the webinar. I'll put Dr. Kovid on live. Aniket?
Yes, doctor, you are live now and PPT is live.
Good morning. This is Dr. Kovid Pandey, and I'll be telling you about Know Your Heart. So, heart is basically the primary organ of body which helps in the circulation of blood. So, if there is anything happens or any factor which affects the heart health, then it will affect the whole body. So, the blood circulation is the main part of the body. If suddenly anywhere blood circulation stops or anything happens to the circulatory system, then it will affect the body, and there will be many signs and symptoms which will adversely affect the body. So here comes the question: how do we know if your heart is healthy or unhealthy? Okay, so there are few factors, few signs, few symptoms which always tells us about the heart health. So there are basically two factors we have divided into: modifiable factors and non-modifiable factors. Basically, what happens? Modifiable factor is once these factors are present in the body, these can be changed today, tomorrow, even though any time of the life we can change these factors. And the non-modifiable factors are non-changeable, irreversible, basically. So basically, the non-modifiable factors are age. It depends on the age of the person. Mostly middle age group and the elder age group have more cardiovascular diseases. The gender, male population are generally more affected with the heart disease than the female because of the many reasons. Family history, if there's any history of family, basically at genetics level, any heart disease or any modifiable factor history, basically a diabetes history or hypertension history, then it will indirectly will affect the heart health. Race population, there are many population towards the world which are segmentally common to the cardiovascular disease. And now comes the modifiable factor. These factors plays a key role in the cardiovascular health. So these are high cholesterol levels. Basically, when there is a high lipid level, high LDL, high triglyceride level, high total cholesterol level, this will affect the circulation of heart, because this will ultimately result in the blockage of the arteries. And if there is a blockage of the artery, basically what we know is atherosclerosis is the blockage of artery, which hampers the circulation of blood. So this, if the circulation of blood is hampered, then there is a less supply of oxygen towards the various part of body, because nutrition and oxygen is not always going through the blood. And if there is any blockage or anything, then it will affect the heart body health. Apart from this, next is high blood pressure, which is usually we know to have as hypertension. So this is also related to genetics or in the dietary pattern. This can also affect the hypertension, because if the pressure of the blood vessels is more, the heart will have to work more, and if heart will have to work more, then this will ultimately result to the disease form of cardiovascular. Next is diabetes. So various form of diabetes are type 2 diabetes is most common, which can affect the heart health. So significantly, if hypertension and diabetes both are present, then it will ultimately just targeting the heart and hamper the circulation. Obesity. Obesity is most common these days because of lifestyle, sedentary lifestyle. If person is not able to have a sedentary lifestyle, no walking, no jogging, no exercise, no physical activity, then ultimately it will result into the obesity, and it will affect the heart health. At last, I've already told the lack of physical activity. Basically, a sedentary lifestyle can affect all these. Sedentary lifestyle, basically, if a person is not going for an exercise, not even no physical activity, then the person is more prone to have diabetes, obesity issues, high cholesterol levels, because this get accomplished and accumulated in the body. And if no physical activity is done or no exercise is done, then these levels of blood sugar levels, cholesterol level is not used up. So it will affect the body. Next, last, that is mental stress and depression. So there are many hormones issue, or apart from this stress level, that will ultimately indirectly affect the heart health, because this, ultimately stress or depression can also affect the blood pressure level. Maybe a stress can also lead to the hypertension, BP issues, high BP issues. Then it will affect the heart health. So basically, what happens if we have any type of heart disease? Then it is most commonly known as CVD, that is cardiovascular disease or cardiovascular accident. We also used to do so. Apart from this, there is coronary artery disease, that is the artery gets blocked. Then it is a coronary artery disease, and in the medical term, we used to get it as atherosclerosis. And the ultimate result is MI, the myocardial infarction, basically a minor heart attack, we used to know. Peripheral vascular disease, PVD, that is the vessels which usually, if I'll just, you can see it in this PVD, peripheral vascular, the peripheral veins of arteries and get blocked. So this will ultimately result in the clots and decrease in the blood flow, and it will hamper the surrounding area. Apart from this, next is the hypertensive disease. I have already told that hypertensive disease can ultimately affect the heart health by different pressure. So you can see the hypertension, the pressure is more than that, then the person will have the hypertension, and ultimately it will just put pressure on the walls of arteries. If the pressure is more, then ultimately it will result in the disease of our heart. Okay, so basically what happens is that if high cholesterol levels, so you can see already, you see that there is blood circulation from this area. These are plaques. These are ultimate deposition of cholesterol, lipids, triglycerides. So these get deposited in the walls of arteries, and if it deposited in the walls of arteries, then the space becomes narrow and blood flow also decreases. So first of all, if this space is not filled with these clot, then there is a normal circulation of blood. After that, if there is a presence of clot, the space becomes narrows and the blood circulation hampers, and this becomes clot. Ultimately, at end result is that there is a whole blockage of this artery, and blood circulation is stopped. Blood circulation is stopped, and this will ultimately result in the MI, that is atherosclerosis and cardiovascular disease. So how to know what are the medical emergencies? This is angina. Basically, this is a pain in the heart, basically left side, and it also radiates to the shoulder region. Heart attack or MI, I already told that atherosclerosis can lead to the MI. Apart from this, next is stroke. Stroke is brain stroke. If the hypertension and the pressure becomes more, it affects the vessels of brain also. Okay. Apart from this, stroke can be due to the ischemic, and ischemic, basically the oxygen deficiencies will be there, deficiency of oxygen. Aneurysm, if there is any anatomical variation, any abnormal dilatation of artery or vein, then it will ultimately result into the heart disease. And sudden cardiac arrest. Okay, and what will be the symptoms? There's a balancing change, eye will be changed, there are vision changes. Okay, sudden loss of vision will be there. Facial drop, there is a sudden drop in the facial muscles, because the muscles will not work properly. Slurring of speech. Okay, so these will be the basic symptoms of the stroke. Okay. So what are the signs of the cardiac emergency? Basically, if these signs are present, it ultimately results in a medical emergency and patient need to be treated. Okay, chest discomfort, basically squeezing type of pain. Squeezing time, if we certainly squeezing something, that type of pain in the mediastinal region, basically middle of the chest region. Okay, there will be a high, little bit more pressure, tightness, pain. So basically, what we denote is that it has a squeezing pain. Okay. Apart from this, there are many pain fiber which radiates to our jaw and shoulder region. So these pain radiates, basically pain travels from one region to another. So this will travel to the shoulder region, neck region. There will be a discomfort in jaw pain. Okay. Apart from the next, the symptom will be the shortness of breath, because the blood supply is not proper at different areas. So it will result in the shortness of breath. There will be a weakness of the maybe a one-sided weakness of both sides, hemiparesis. Okay, so the paresis means the paralysis, or we can ultimately known as weakness. Okay, so there will be a certain profound weakness. It can maybe in the both side, upper limb, lower limb, or both sides. Okay, depending on the severity of heart attack. Apart from the dizziness, patient will feel vertigo and a little bit discomfort, more sweating, nausea, vomiting, gastric discomfort, high acidity. So this will these are the signs of cardiac emergency. And if in the later age group, means if they're in 50s or 55 of years of age, if a person is having acidity symptom, that it not couldn't be just ruled out as a gastritis or acidity. It can denotes the MI, that is a heart attack symptoms. Okay, sweating, loss of consciousness. Basically, a patient will just not properly walk, not properly just not have a sense, not just will not able to differentiate the with where he is, time, place, person. Okay, so these are the basic symptoms. So again, I'm just repeating the signs of cardiac emergency: shortness of breath. Okay, lighten and nausea, vomiting, and gastric discomfort, acidity, gastritis. Okay, excessive sweating, chest discomfort, pain will radiate to the shoulder region, neck region, jaw region. Okay, and fatigue at last. So these are the signs and signs of the cardiac emergency, and this should not be avoided if any person is having these, and should be go to the hospital for the medical emergency. Okay, so this is the category where you have to understand. This is a basic summarization of the whole session. That is, these factors will denote that these can affect the heart. Okay, and these factors are just affecting that you have to follow these steps so that your heart becomes more healthier. Okay, so the symptom at the earlier of this session, I'll just already told that these are the factors which can affect the heart health. Okay, high blood pressure, that is hypertension, high blood cholesterol level. Okay, overweight or obese due to the sedentary lifestyle, pre-diabetes or diabetes, genetic history of diabetes and hypertension, smoking and alcohol is the main cause of the heart attacks. Okay, sedentary lifestyle, no physical activity, have a family history of earlier disease, that is the genetics I already told, have a history of preeclampsia. Preeclampsia is in the pregnancy, basically the hypertension issues. Okay, so this preeclampsia terms is used for the pregnant lady. If the pregnant lady is having the BP issues, high blood pressure issues, have unhealthy eating behaviors. Basically, if he is eating a junk food or oily food, fried food, these should be avoided. If person is taking, then he has to go for a physical activity so that he can use the basic toxic element as removed from the body. Okay, and women of age group of 55 or older because of the menopause, man middle age group and older age group are the common criteria of having a heart disease. So these are proper things which you have to monitor. That is, get your blood pressure and cholesterol always checked by having a lipid profile test by the blood test. Apart from this, get a BP machine. You can have a digital BP machine. You can track your blood pressure. If there's a family history of blood pressure, then you have diabetes, blood pressure, then you have to control your diet, go for physical activity, brisk walking, jogging, have a healthy diet, that is a balanced diet, good, rich in food, fruits and green leafy vegetables, citrus fruits. Okay, and you can calculate your BMI. There are many formulas of BMI. You can go and get calculated and maintain a healthy weight. Apart from this, you have to go for physical activity. You have to quit this smoking. Okay, smoking is just directly affecting the vessels of heart. A good sleep, 7 hours or more of good sleep can have just maintain your body circulation, health, the hormones, and also manages the stress and anxiety you are always having. Okay, so you have to control these factors and get a properly check your all the body parameters on a 3 to 4 months basis. Okay, thank you, take care.
Okay, thank you, doctor.